Honestly, this is one of my favorite topics. Prostate artery embolization is considered one of the most successful achievements in interventional medicine in the last decade. Finally, today, urology offers many methods of treating benign prostatic hyperplasia, which affects a large number of men. At the age of 40, the symptoms of this condition become more pronounced. By the age of 70, about 80% of men suffer from this pathology. This means that at some point, every man will eventually receive this diagnosis. The only question is how severe the symptoms will be. Although benign prostatic hyperplasia is often considered a non-serious disease, this is not the case. This is confirmed by the results of an interesting study presented in the official documents of the German Society of Urology. According to the study, the burden on patients with benign prostatic hyperplasia and its associated symptoms is equivalent to the burden on patients with epilepsy. One of the reasons for this is the uncontrollable external manifestations of these diseases. Just as patients with benign prostatic hyperplasia do not know whether they will have to run to the toilet in the next 30 seconds, patients with epilepsy cannot predict when their next seizure will occur. Therefore, treatment should be aimed at eliminating nocturia and the constant feeling of incomplete bladder emptying. Now, we are discussing patient-oriented treatment aimed at eliminating the annoying symptoms of benign prostatic hyperplasia, such as nocturia, urgency, imperative urge to urinate, and the feeling of an incomplete bladder emptying. Meanwhile, improving the urine stream becomes less important, as indicated in a urological publication from over 50 years ago. For patients, this is the least important factor. This means that publications in the tabloid press and certain discussions emphasize weak urine streams. However, this is the least important problem for patients. As a highly qualified doctor, your first priority should be to focus on the symptoms that bother a particular patient. These are the irritating symptoms. Therefore, surgical reduction of the size of the prostate to improve urine flow can be successfully achieved using conventional urological techniques. However, as everyone knows, it causes a number of side effects. The first priority is to address the symptom of retrograde ejaculation. With this disorder, sperm enters the bladder during ejaculation and is excreted with urine during urination. Patients with retrograde ejaculation who undergo conventional prostate adenoma treatment will be unable to conceive in the future. This fact must be communicated to patients. Other side effects should also be discussed, such as the risk of bleeding. Over the last 10 years, prostate artery embolization has proven to be a highly effective, sparing, and patient-friendly treatment method. Ultimately, it is preferred because it does not cause side effects. Of course, providing this treatment requires skills in interventional procedures, since access to the prostate arteries and navigation manipulations require extensive experience and appropriate equipment. In this regard, urologists are very concerned about the possible outflow of patients and the prospect of having no one left to treat soon. However, this is not true, as there are not many interventional radiologists in the world who can meet patient demand. So, there is nothing to worry about for now. It is also important to consider which patients may be candidates for prostate artery embolization. This procedure is certainly suitable for young men who want to maintain their sexual function and have children in the future. It is noteworthy that prostate artery embolization is the only procedure proven to improve erectile function. This fact is scientifically proven and published in scientific journals. This is not surprising, because the more the prostate increases in size, the more the blood flow to the gland increases, which, with a normal prostate size, would be distributed to other nearby organs. Therefore, it's not rocket science. It's quite simple. When blood flow to the prostate decreases, erectile function improves. As I said before, these are not unfounded statements, but scientifically proven facts. We personally published publications on this topic, as did the research group led by Professor Pisco from Lisbon. Prostate artery embolization is indicated for young patients and those with certain morphological criteria. In benign prostatic hyperplasia, the prostate gland does not enlarge to resemble an orange. Rather, the organ's architecture changes, and certain pathological changes appear in its structure. For example, there may be a kink in the prostatic urethra. This treatment method is also indicated for patients unable to undergo full-fledged surgery due to other concomitant diseases, bleeding risks, or anesthesia intolerance. One final point that I want and should mention is that our research group was the first to use arterial embolization for prostate cancer treatment. This is quite an interesting point because essentially the main treatments for prostate cancer are drug therapy, surgery, and radiation therapy. However, radiation therapy is only effective for small prostate tumors. Unfortunately, prostate cancer can involve larger tumors as well. We had the brilliant idea to embolize the prostate arteries as a neoadjuvant therapy before irradiation to reduce the volume of the prostate gland. This would allow us to achieve a prostate volume of less than 50 milliliters for more effective and technically sparing irradiation. This scientific publication brought us wide recognition, not only in Germany, but also, above all, in the United States. Radiation therapy has lower risks than surgery, including a lower risk of urinary incontinence and erectile dysfunction. The smaller the prostate gland, the more sparing the radiation will be. As I said, this is not rocket science. All this knowledge is already available. All that needs to be done is correctly match all the pieces of the puzzle. With this combination of methods, we achieve a dramatic increase in the quality and effectiveness of therapy, and it becomes possible to help patients who were previously considered untreatable. Uterine artery embolization for the treatment of uterine fibroids has been practiced for a long time, and it is an effective method of treating benign uterine tumors. This procedure alleviates symptoms and makes it possible to preserve the affected organ, which is of key importance in the context of treating uterine fibroids. Uterine artery embolization eliminates the need for a hysterectomy, an operation to remove the uterus. It is noteworthy that there are countries where, frankly speaking, uterine artery embolization is performed as if on a conveyor belt. This may not sound respectful on my part, but the fact remains. There are also countries where gynecologists regularly perform uterine fibroid removal operations, whether endoscopic interventions or hysterectomies. Based on my clinical experience, I can say that we often see disappointed and dissatisfied patients in our consultations who wish they had received information about uterine artery embolization much earlier. This is due to frequent failures to comply with the principle of joint decision-making regarding therapy choices, in which the patient's opinion should be taken into account. The number of well-informed patients is increasing now. They know exactly why they need a certain type of therapy in their particular situation. Therefore, uterine artery embolization is an effective and safe procedure for treating uterine myomas, fibroids.